1. What is the primary function of the central nervous system, CNS? A. Sensory processing. B. Coordination of voluntary movement. C. Regulating hormone levels. D. Controlling reflexes. Answer. B. Coordination of voluntary movement. Rationale. The CNS, including the brain and spinal cord, is primarily responsible for coordinating voluntary movements, integrating sensory information, and controlling higher functions like cognition. Sensory processing, option A, and reflex control, option D, are functions of the nervous system, but voluntary movement coordination is the core function. Regulating hormone levels, option C, is managed by the endocrine system. 2. Which part of the brain is responsible for regulating heart rate and respiratory rate? A. Cerebellum. B. Medulla oblongata. C. Thalamus. D. Hypothalamus. Answer. B. Medulla oblongata. Rationale. The medulla oblongata controls autonomic functions such as heart rate, respiratory rate, and blood pressure. The cerebellum, option A, is involved in coordination and motor control. The thalamus, option C, relays sensory information to the cerebral cortex. The hypothalamus, option D, regulates temperature, hunger, and hormone release. 3. A patient is experiencing a headache, nausea, and vomiting. A CT scan reveals a mass in the brain. Which part of the brain is most likely to be involved in these symptoms? A. Cerebellum. B. Occipital lobe. C. Frontal lobe.
D. Brainstem.
Answer. D. Brainstem. Rationale. The brainstem controls vital functions such as respiration and heart rate and can cause symptoms like nausea and vomiting when affected by a mass. The cerebellum, option A, is involved in motor control, and the occipital lobe, option B, processes vision. The frontal lobe, option C, is responsible for higher cognitive functions but would not directly cause nausea and vomiting. 4. Which neurological disorder is characterized by the loss of myelin in the central nervous system? A. Parkinson's disease. B. Multiple sclerosis. C. Alzheimer's disease. D. Huntington's disease. Answer. B. Multiple sclerosis. Rationale. Multiple sclerosis, MS, is an autoimmune disorder where the immune system attacks the myelin sheath of nerve fibers in the CNS, leading to impaired neural transmission. Parkinson's disease, option A, affects dopamine-producing neurons. Alzheimer's disease, option C, is associated with cognitive decline, and Huntington's disease, option D, causes motor and cognitive symptoms due to basal ganglia degeneration. 5. A patient presents with sudden onset of weakness in the right arm and slurred speech. What is the most likely diagnosis? A. Stroke. B. Seizure. C. Multiple sclerosis. D. Migraine headache. Answer. A. Stroke. Rationale. A stroke typically presents with sudden onset neurological deficits such as weakness, hemiparesis, and speech difficulties, aphasia or dysarthria. Seizures, option B, do not typically cause lasting deficits, and multiple sclerosis, option C, presents more slowly with relapsing remitting symptoms. Migraine headaches, option D, may cause temporary neurological symptoms but are not typically associated with focal weakness. 6. What is the main neurotransmitter implicated in Parkinson's disease? A. Serotonin. B. Acetylcholine. C. Dopamine. D. Norepinephrine. Answer. C. Dopamine. Rationale. Parkinson's disease is primarily caused by the degeneration of dopamine-producing neurons in the basal ganglia. Serotonin, option A, acetylcholine, option B, and norepinephrine, option D, are involved in other neurological functions, but are not the primary neurotransmitters involved in Parkinson's disease. 7. Which cranial nerve is responsible for facial sensation? A. Trigeminal nerve, CNV. B. Facial nerve, CN7. C. Vagus nerve, CNX. D. Optic nerve, CN2. Answer. A. Trigeminal nerve, CNV. Rationale. The trigeminal nerve, CNV, is responsible for sensory input from the face, including touch, pain, and temperature sensations. The facial nerve CN7 controls facial muscles. The vagus nerve CNX is involved in parasympathetic functions, and the optic nerve CN2 is responsible for vision. 8. A nurse is assessing a patient with suspected meningitis. Which symptom would be most indicative of this condition? A. Nuchal rigidity. B. Hemiparesis. C. Positive Romberg sign. D. Ataxia. Answer: A. Nuchal rigidity. Rationale: nuchal rigidity, or neck stiffness, is a classic sign of meningitis due to inflammation of the meninges surrounding the brain and spinal cord. Hemiparesis, option B, is more indicative of a stroke, and ataxia, option D, is a lack of coordination seen in cerebellar disorders. A positive Romberg sign, option C, suggests a proprioception or vestibular issue, not meningitis. 9. Which of the following is a typical early symptom of Alzheimer's disease? A. Sudden loss of consciousness. B. Memory loss. C. Visual hallucinations. D. Hemiplegia. Answer: B. Memory loss. Rationale: early symptoms of Alzheimer's disease typically include memory loss, particularly short-term memory, which is one of the first signs of cognitive decline. Sudden loss of consciousness, option A, visual hallucinations, option C, and hemiplegia, option D, are not typically early signs of Alzheimer's. 10. A patient is admitted with a seizure disorder. Which is the priority nursing intervention during an active seizure? A. Administering anti-seizure medication. B. Ensuring a patent airway and preventing injury. C. Assessing the patient's vital signs. D. Observing the duration and characteristics of the seizure. Answer: B. Ensuring a patent airway and preventing injury. Rationale: the priority during a seizure is to ensure the patient's safety by maintaining a patent airway and preventing injury. Administering medication, option A, is important but not the first priority during an active seizure. Vital signs, option C, and seizure observation, option D, are important but secondary during the actual event. 11. Which condition is characterized by the progressive loss of muscle strength and coordination due to the destruction of motor neurons? A. Multiple sclerosis. B. Amyotrophic lateral sclerosis. C. Parkinson's disease. D. Myasthenia gravis. Answer: B. Amyotrophic lateral sclerosis. Rationale: amyotrophic lateral sclerosis, ALS, is a neurodegenerative disease that causes progressive muscle weakness and coordination problems due to the degeneration of motor neurons. Multiple sclerosis, option A, involves demyelination of neurons, while Parkinson's disease, option C, affects dopamine production, and myasthenia gravis, option D, is a neuromuscular junction disorder. 12. A patient with a suspected stroke is undergoing a CT scan. Which part of the brain is most likely affected in a stroke involving speech difficulties? A. Cerebellum. B. Parietal lobe. C. Basal ganglia. D. Temporal lobe. Answer: C. Basal ganglia. Rationale: the basal ganglia are commonly affected in ischemic strokes, particularly in conditions like stroke-related movement disorders. The cerebellum, option A, is involved in coordination. The parietal lobe, option B, processes sensory information, and the temporal lobe, option D, is involved in auditory processing. 13. Which of the following is a common side effect of antiepileptic drugs? A. Bradycardia. B. Drowsiness. C. Hypertension. D. Hyperglycemia. Answer: B. Drowsiness. Rationale: drowsiness is a common side effect of antiepileptic drugs, AEDs, as these medications often depress the central nervous system. Bradycardia, option A, and hypertension, option C, are less commonly associated with AEDs, while hyperglycemia, option D, is typically linked with corticosteroid therapy. 14. A patient with trigeminal neuralgia is prescribed carbamazepine. What is the primary reason for this medication? A. Reduces inflammation in the trigeminal nerve. B. Stabilizes the neuronal membrane to prevent pain. C. Increases neurotransmitter levels in the brain. D. Blocks pain receptors in the trigeminal nerve. Answer: B. Stabilizes the neuronal membrane to prevent pain. Rationale. Carbamazepine works by stabilizing the neuronal membrane, which prevents the excessive firing of neurons that causes the intense pain in trigeminal neuralgia. It does not reduce inflammation, option A, increase neurotransmitter levels, option C, or block pain receptors, option D. 15. What is the most common cause of delirium in hospitalized older adults? A. Infection. B. Stroke. C. Hypoxia. D. Dehydration. Answer. A. Infection. Rationale. Infection, particularly urinary tract infections or pneumonia, is a common cause of delirium in older adults. Stroke, option B, hypoxia, option C, and dehydration, option D, can contribute, but infection is the most common cause. 16. A patient presents with a complete loss of sensation on the right side of the body and is unable to move their right arm. Which condition is most likely responsible? A. Hemiplegic migraine. B. Left-sided stroke. C. Transient ischemic attack. D. Cerebellar ataxia. Answer. B. Left-sided stroke. Rationale. A left-sided stroke can lead to right-sided hemiplegia, loss of motor function, and sensory loss due to the brain's contralateral control. Hemiplegic migraines, option A, are less likely to present with complete loss of sensation and motor function. A transient ischemic attack, option C, would typically resolve quickly, and cerebellar ataxia, option D, affects coordination rather than causing unilateral sensory and motor loss. 17. A nurse is teaching a patient with epilepsy about seizure precautions. Which of the following should be included in the teaching plan? A. Restrict physical activity. B. Lie down immediately when feeling a seizure coming on. C. Avoid alcohol consumption. D. Always take a hot shower to relax the muscles. Answer. C. Avoid alcohol consumption. Rationale. Alcohol can lower the seizure threshold and increase the frequency of seizures, so it should be avoided. Restricting physical activity, option A, is unnecessary unless recommended by a healthcare provider. Lying down immediately, option B, is not recommended during a seizure due to fall risk, and hot showers, option D, can increase the risk of fainting. 18. A 45-year-old patient is diagnosed with Parkinson's disease. Which of the following is the most common symptom at the onset of the disease? A. Bradykinesia. B. Tremor. C. Postural instability. D. Rigidity. Answer. B. Tremor. Rationale. A resting tremor is one of the hallmark symptoms of Parkinson's disease and is often the first sign of the disease. Bradykinesia, option A, postural instability, option C, and rigidity, option D, develop as the disease progresses. 19. Which of the following is a primary goal of treatment for patients with myasthenia gravis? A. Increasing acetylcholine production. B. Increasing dopamine production. C. Inhibiting acetylcholinesterase. D. Reducing norepinephrine levels. Answer. C. Inhibiting acetylcholinesterase. Rationale. The goal in treating myasthenia gravis is to inhibit acetylcholinesterase, thereby prolonging the action of acetylcholine at the neuromuscular junction. Increasing acetylcholine production, option A, and dopamine production, option B, are not primary treatments for this disorder, and norepinephrine, option D, is not directly involved in the treatment. 20. A patient with a head injury is being evaluated for increased intracranial pressure, ICP. Which of the following is a late sign of increased ICP? A. Pupillary constriction. B. Decreased level of consciousness. C. Increased heart rate. D. Vomiting. Answer. B. Decreased level of consciousness. Rationale. A decreased level of consciousness is a late sign of increased ICP, reflecting the brain's inability to maintain normal function due to pressure. Pupillary constriction, option A, occurs earlier, and increased heart rate, option C, is a compensatory response. Vomiting, option D, is also a common symptom but may occur earlier, depending on the severity of the ICP increase. 21. Which condition is commonly associated with pin-rolling tremors? A. Alzheimer's disease. B. Huntington's disease. C. Parkinson's disease. D. multiple sclerosis. Answer: C. Parkinson's disease. Rationale: pin rolling tremors, characterized by a repetitive motion resembling rolling a small object between the thumb and forefinger, are a hallmark symptom of Parkinson's disease. Alzheimer's disease, option A, primarily affects memory. Huntington's disease, option B, causes chorea and cognitive decline. And multiple sclerosis, option D, leads to a variety of neurological symptoms, but not typically pin rolling tremors. 22. A patient with a history of multiple sclerosis, MS, is being treated with corticosteroids. What is the primary purpose of corticosteroid therapy in this patient? A. To prevent demyelination. B. To reduce inflammation and improve symptoms during flare-ups. C. To stimulate the production of new myelin. D. To slow the progression of the disease. Answer: B. To reduce inflammation and improve symptoms during flare-ups. Rationale: corticosteroids are used in MS to reduce inflammation and manage symptoms during acute flare-ups. They do not prevent demyelination, option A, stimulate new myelin production, option C, or slow disease progression, option D, in the long term. 23. A 72-year-old patient is diagnosed with Alzheimer's disease. Which of the following is a common behavior associated with this condition? A. Impulsivity. B. Disorientation and confusion. C. Hyperactivity. D. Decreased appetite. Answer: B. Disorientation and confusion. Rationale: disorientation and confusion, especially with time and place, are common behaviors in Alzheimer's disease. Impulsivity, option A, hyperactivity, option C, and decreased appetite, option D, are not typically associated with Alzheimer's in the early stages. 24. Which of the following is a common complication of a traumatic brain injury, TBI? A. Increased intracranial pressure. B. Spinal cord compression. C. Seizures. D. All of the above. Answer: D. All of the above. Rationale: all of the listed complications can arise from a traumatic brain injury, TBI. Increased intracranial pressure, option A, is a common consequence, and seizures, option C, are also frequently seen following TBI. Spinal cord compression, option B, can occur in cases of neck injury. 25. Which of the following is a characteristic feature of Guillain-Barré syndrome? A. Progressive muscle weakness starting in the lower extremities. B. Symmetrical muscle weakness with facial droop. C. Cognitive decline and memory loss. D. Rapid loss of motor skills in the upper extremities. Answer: A. Progressive muscle weakness starting in the lower extremities. Rationale: Guillain-Barré syndrome is characterized by ascending, progressive muscle weakness, typically starting in the lower extremities. Facial droop, option B, and cognitive decline, option C, are not characteristic features. Rapid loss of motor skills, option D, typically affects the lower limbs first. 26. A nurse is assessing a patient with suspected meningitis. Which of the following signs would be most indicative of meningitis? A. Positive Brudzinski's sign. B. Positive Tunnel's sign. C. Decreased deep tendon reflexes. D. Negative Koenig's sign. Answer: A. Positive Brudzinski's sign. Rationale: a positive Brudzinski sign, which occurs when the patient involuntarily flexes their knees upon flexion of the neck, is indicative of meningitis. Tunnel's sign, option B, is used to assess for nerve compression, and decreased deep tendon reflexes, option C, are not indicative of meningitis. Koenig's sign, option D, would be positive in meningitis if the patient experiences pain when trying to extend their leg. 27. Which of the following is an early sign of increased intracranial pressure, ICP? A. Decreased level of consciousness. B. Sudden onset of headache. C. Dilated pupils. D. Cushing's triad. Answer: B. Sudden onset of headache. Rationale: a sudden onset of headache is an early sign of increased ICP. Decreased level of consciousness, option A. Dilated pupils, option C, and Cushing's triad, option D, are later signs of significant ICP elevation. 28. A patient with a spinal cord injury at the T6 level is at risk for developing which of the following conditions? A. Autonomic dysreflexia. B. Pneumonia. C. Pulmonary embolism. D. Hypoglycemia. Answer: A. Autonomic dysreflexia. Rationale: autonomic dysreflexia is a life-threatening condition that can occur in patients with spinal cord injuries at or above the T6 level. Pneumonia, option B, and pulmonary embolism, option C, are concerns, but autonomic dysreflexia is the most directly associated condition. Hypoglycemia, option D, is not commonly linked with spinal cord injuries. 29. A 30-year-old patient presents with a history of frequent seizures that are not well controlled by medications. The doctor suggests the patient consider a vagus nerve stimulator, VNS. What is the purpose of a VNS? A. To prevent brain cell damage during seizures. B. To regulate the firing of neurons in the brain. C. To stimulate the vagus nerve to prevent seizures. D. To replace oral antiepileptic drugs. Answer: C. To stimulate the vagus nerve to prevent seizures. Rationale: a vagus nerve stimulator, VNS, works by delivering electrical impulses to the vagus nerve, which can help reduce the frequency of seizures in patients who do not respond well to medications. It does not replace antiepileptic drugs, option D, or regulate neuron firing, option B. 30. A nurse is caring for a patient with a recent diagnosis of brain cancer. Which symptom is most likely related to a brain tumor? A. Blurred vision. B. Fever. C. Severe nausea and vomiting. D. Diarrhea. Answer: C. Severe nausea and vomiting. Rationale: severe nausea and vomiting are common symptoms of increased intracranial pressure, which can be caused by a brain tumor. Blurred vision, option A, can occur but is less directly linked, while fever, option B, and diarrhea, option D, are not typically caused by brain tumors. 31. Which of the following is the most common cause of ischemic stroke? A. Atrial fibrillation. B. Carotid artery dissection. C. Aneurysm rupture. D. Acute hypertension. Answer: A. Atrial fibrillation. Rationale: atrial fibrillation increases the risk of embolic strokes due to blood clots traveling to the brain. 32. A 25-year-old patient presents with a sudden onset of unilateral facial weakness. Which condition should be suspected? A. Bell's palsy. B. Cerebral palsy. C. Myasthenia gravis. D. Multiple sclerosis. Answer: A. Bell's palsy. Rationale: Bell's palsy is characterized by sudden, unilateral facial weakness, often due to viral infection. 33. A nurse is educating a patient about the risk factors for Alzheimer's disease. Which of the following is the greatest risk factor for this condition? A. Age. B. Family history. C. Physical inactivity. D. Low socioeconomic status. Answer: A. Age. Rationale: the greatest risk factor for Alzheimer's disease is age, with the risk increasing significantly after age 65. 34. A nurse is caring for a patient with Parkinson's disease. Which of the following medications is commonly used to manage symptoms? A. Levodopa. B. Insulin. C. Furosemide. D. Lisinopril. Answer: A. Levodopa. Rationale: levodopa is commonly used to increase dopamine levels in the brain and manage Parkinson's disease symptoms. 35. A patient with a history of seizures is prescribed phenytoin. Which of the following side effects should the nurse monitor for? A. Gingival hyperplasia. B. Nausea and vomiting. C. Photosensitivity. D. Tachycardia. Answer: A. Gingival hyperplasia. Rationale: phenytoin is associated with gingival hyperplasia, a common side effect. 36. Which of the following is the first sign of increased intracranial pressure, ICP? A. Vomiting. B. Decreased level of consciousness. C. Severe headache. D. Dilated pupils. Answer: C. Severe headache. Rationale: a sudden, severe headache is often the first sign of increased ICP due to the pressure on brain structures. 37. A patient is diagnosed with Guillain-Barré syndrome. Which of the following is the most common initial symptom? A. Progressive muscle weakness. B. Loss of sensation. C. Seizures. D. Respiratory depression. Answer: A. Progressive muscle weakness. Rationale: Guillain-Barré syndrome typically presents with progressive muscle weakness starting from the lower limbs. 38. Which of the following is the most important intervention for a patient experiencing a tonic-clonic seizure? A. Protect the head and ensure a clear airway. B. Restrain the patient to prevent injury. C. Administer an anticonvulsant immediately. D. Place a tongue depressor in the mouth. Answer: A. Protect the head and ensure a clear airway. Rationale: protecting the head and ensuring a clear airway are the most important steps during a seizure. Restraining the patient or placing an object in the mouth can cause injury. 39. A patient presents with sudden confusion, weakness in one arm, and difficulty speaking. What is the most likely diagnosis? A. Stroke. B. Migraine headache. C. Seizure disorder. D. Transient ischemic attack, TIA. Answer: A. Stroke. Rationale: sudden confusion, weakness, and difficulty speaking are classic signs of a stroke. 40. A patient with multiple sclerosis is receiving interferon beta, 1A. What is the most common side effect of this medication? A. Flu-like symptoms. B. Hypotension. C. Gastrointestinal bleeding. D. Hyperkalemia. Answer: A. Flu-like symptoms. Rationale: interferon beta, 1A, commonly causes flu-like symptoms as a side effect. 41. A 45-year-old patient presents with a tremor, bradykinesia, and rigidity. Which of the following is the most likely diagnosis? A. Parkinson's disease. B. Multiple sclerosis. C. Amyotrophic lateral sclerosis, ALS. D. Huntington's disease. Answer: A. Parkinson's disease. Rationale: Parkinson's disease is characterized by tremor, bradykinesia, and rigidity. These are hallmark symptoms of this neurodegenerative disorder. 42. A nurse is caring for a patient who recently suffered a traumatic brain injury. Which of the following is the most sensitive indicator of neurological deterioration? A. Blood pressure changes. B. Glasgow Coma Scale score. C. Pupillary response. D. Respiratory rate. Answer: B. Glasgow Coma Scale score. Rationale: the Glasgow Coma Scale, GCS, is the most sensitive tool for monitoring changes in consciousness and neurological deterioration. 43. A 30-year-old patient presents with a sudden onset of double vision and difficulty swallowing. Which condition should the nurse suspect? A. Myasthenia gravis. B. Guillain-Barré syndrome. C. Amyotrophic lateral sclerosis, ALS. D. Multiple sclerosis. Answer: A. Myasthenia gravis. Rationale: myasthenia gravis typically presents with symptoms like double vision and difficulty swallowing due to impaired neuromuscular transmission. 44. A patient with suspected meningitis is undergoing a lumbar puncture. Which of the following findings would support a diagnosis of bacterial meningitis? A. Clear cerebrospinal fluid, CSF. B. High white blood cell count in CSF. C. Low protein levels in CSF. D. Elevated glucose levels in CSF. Answer: B. High white blood cell count in CSF. Rationale: bacterial meningitis typically presents with an elevated white blood cell count, pleocytosis, in the cerebrospinal fluid, CSF. 45. A 65-year-old patient is diagnosed with a stroke and is experiencing hemiplegia. Which of the following is the most appropriate initial intervention? A. Administer thrombolytics within 3 to 4.5 hours. B. Perform a head CT scan. C. Begin rehabilitation therapy. D. Provide a low-salt diet. Answer: A. Administer thrombolytics within 3 to 4.5 hours. Rationale: thrombolytics, such as TPA, are most effective when administered within 3 to 4.5 hours of stroke onset to dissolve clots and minimize brain damage. 46. A patient with a history of frequent seizures is prescribed valproic acid. Which of the following side effects should the nurse monitor for? A. Weight gain. B. Hyperreflexia. C. Diarrhea. D. Hypoglycemia. Answer: A. Weight gain. Rationale: valproic acid can cause weight gain as a side effect, along with other potential side effects like hepatotoxicity. 47. A nurse is caring for a patient who has undergone a craniotomy. Which of the following assessments is most important in the first 24 hours postoperatively? A. Neurological status. B. Intake and output. C. Vital signs. D. Pain level. Answer: A. Neurological status. Rationale: close monitoring of neurological status, including level of consciousness and motor response, is crucial after craniotomy to detect complications like hemorrhage or increased ICP. 48. A patient presents with a sudden onset of headache, photophobia, and a stiff neck. What is the nurse's primary concern? A. Meningitis. B. Migraine headache. C. Cluster headache. D. Tension headache. Answer: A. Meningitis. Rationale: these symptoms, headache, photophobia, and stiff neck, are classic signs of meningitis, which is a medical emergency requiring immediate intervention. 49. A 60-year-old patient with a family history of Alzheimer's disease asks about prevention strategies. Which of the following interventions should the nurse recommend? A. Engage in regular physical exercise. B. Increase intake of antioxidants. C. Limit social interactions. D. Increase protein intake. Answer: A. Engage in regular physical exercise. Rationale: regular physical exercise has been shown to reduce the risk of Alzheimer's disease and improve cognitive function. 50. Which of the following is a common complication of a spinal cord injury at the T6 level or higher? A. Autonomic dysreflexia. B. Hydrocephalus. C. Brainstem herniation. D. Guillain-Barré syndrome. Answer: A. Autonomic dysreflexia. Rationale: autonomic dysreflexia is a common complication of spinal cord injuries at or above the T6 level, characterized by a sudden increase in blood pressure in response to a noxious stimulus.